So not all rhinoplasty surgery is done for cosmetic reasons, certainly in my hands. I have patients who come to me for breathing related problems, and so it's important for me to assess the nose properly, and that will involve examining the base of the nose, examining things externally, but also passing a camera or an endoscope into the nose. And in this particular patient, I was unable to pass the camera at all really on the left hand side because of the severity of her deviated nasal septum. So if we now have a look from the base view here, what we can see is she has what we call a caudal septal deviation. So that left nostril is partly occluded, which is actually distorting some of the anatomy of the nose, whereby it almost looks like she's got too much bulk here. When the deviations are so near the front of the nose, what we refer to as being very caudal in nature, I sometimes have to undertake surgery through an open or an external approach. And here you can see the scar, and this is about 2 months post-surgery. And I make no secret of having the odd small scar there because I think they heal genuinely really well and barely noticeable, and this is 2 months down the line. I had to undertake an open approach because the deviation was so near the front of the nose. So here I made a cut, lifted up the skin, had to correct the deviated nasal septum to try and straighten the anatomy. So here we can see that the nose is far straighter than on this particular one where it's almost lying at one angle. So her left nasal cavity previously was completely blocked up. I've tried to maintain a degree of symmetry at the nasal tip, and bear in mind at 2 months there's still a fair bit of swelling still to come down. But she's delighted, she's able to breathe better, and importantly respected her wishes at not changing her anatomy too much, certainly from the outside.